Welcome to Topic 2 of Healthcare Economics and Financial Management. This week, we're covering the topic of U.S. healthcare history and stakeholders. This section of the course is intended to give you background information to understand why healthcare works the way it does in the United States. Our system of healthcare is unique in the developed world. The U.S. has a complicated system of healthcare involving multiple stakeholders. If you're going to be making financial management decisions, you have to understand the system and the players. There's a lot of content in Topic 2, but we're going to go broad instead of deep. The learner outcomes for this topic are provided in your syllabus and on Canvas. This is what you should be able to accomplish by the end of Topic 2. You'll be able to describe the evolution of the U.S. healthcare system, anticipate ways in which the Affordable Care and Patient Protection Act can potentially influence healthcare delivery and outcomes. You'll define and identify where healthcare costs are primarily used. You'll be able to identify the major stakeholders within the healthcare system. You'll describe the function and features of health insurance. And finally, you'll provide information on how the federal, state, and other regulatory agencies affect our healthcare system. You can think about the content in Topic 2 in three big chunks. The first chunk is the history and evolution of the U.S. healthcare system. To understand how healthcare policy has developed, you'll need to have information about what was happening in society. So we're going to take a look at how healthcare has developed from 1800 to the present day. The second chunk of content briefly covers trends and issues affecting the future of our healthcare system. I'll discuss a few here, and we'll cover much more as the trimester progresses. The third and final chunk of content is an examination of the five stakeholders in our current system. We'll look at the roles played by consumers, providers, payers, suppliers, and regulators. And this will include a closer look at how exactly health insurance works. I want you to start by reading about the history and evolution of the U.S. healthcare system. If you have the Legere and Dunham-Taylor textbook, please read Chapter 1. If you don't, then go straight to the readings I've posted on Canvas. The History of Health Reform is a web link on Canvas which tells the stories of how healthcare policy developed over time. As you read through the history, take note of the various federal laws and policies that were proposed. What failed? What succeeded? Why? All of this history has shaped our current system. You can follow the timeline of federal healthcare more directly by looking at the web link called Historical Highlights. These are highlights of the Department of Health and Human Services, and it's also posted on Canvas. You've probably covered the 2010 Affordable Care and Patient Protection Act, otherwise known as Obamacare, in other courses, but if you need a review of its purpose and provisions, I've posted a summary on Canvas from the Kaiser Family Foundation, so I encourage you to take a look at it. Your readings on the history and the evolution of healthcare will help you answer the question, how did we get into this mess? As a nation, we spend too much money on healthcare, and we don't always get good outcomes for the money we've spent. As our policies evolved, we chose to spend most of our healthcare budget to treat illness and injuries. In this country, we're very good at keeping people alive when they're critically ill or traumatically injured. We see this every day in NICUs, in surgical suites, even in long-term acute care facilities. Most of our budget in the United States is spent on hospitals and physician specialists. However, we do a poor job at keeping people healthy and well. People have different beliefs and values about the role of government in healthcare, but regardless of those beliefs, most of our policies focus on solving three critical problem areas. Number one, the problem of increasing access to services. Number two, controlling the cost of health care, and 3, improving the quality of health care. You'll take a closer look at our measurable national outcomes for these problems as you learn to use the Healthcare System Tracker dashboard, which I've posted on Canvas. I encourage you to read the brief and watch the tutorial video, then explore the dashboard to see how the U.S. healthcare system is performing compared to both our own outcomes and those of other nations. The end of Chapter 1 in the Leger and Dunham-Taylor textbook examines trends and issues affecting the future of healthcare. We'll talk about more of these as the trimester progresses, and of course we hear about them in the news regularly. Given our current political climate, the future seems highly uncertain. Will the Affordable Care Act be repealed? Will it be replaced by another broad health care bill? How will consumers, payers, and providers react to changes in funding and regulations? We're already seeing signs of decreasing access to health care as hospitals report losses and close their doors, especially in safety net and rural areas. Our aging population is going to put even more strain on health care in 2 ways. Consumers are getting older and sicker, and so is our workforce. Baby boomer nurses, physicians, and other healthcare professionals are retiring, and worker shortages are growing. Economic issues plague not only our federal budgets, but also our state and local ones. If we continue to decrease taxes and decrease our public services, how will that affect our healthcare system? Will it lead to a population of less healthy consumers who are not able to be productive and work to grow the economy? Alternative therapies have been growing in popularity, even though many are not covered by health insurance and people pay for them out of pocket. Could alternative therapies provide ways for people to take charge of their own health? Or are they just a waste of our resources? How will we know? Technology has dramatically affected the cost of our healthcare services, and that's likely to continue. Does it have substantial benefits? Will telehealth and electronic health records increase access and quality outcomes? Is there a point when they may start bringing our costs down? It's hard to know right now. We hope so. The science of genomics has great potential to change the way healthcare services are planned and delivered, but there are unsolved ethical and legal issues. How will it affect our healthcare system? We just don't know. Scientists predict that climate change is going to make our physical environment more hazardous and increase the need for disaster preparedness and infectious disease prevention. How are we going to cope with the increased needs for healthcare services? Who will provide these services? Are there other issues that we haven't even identified yet? Probably. What we can say is that it's not likely that delivering safe, effective, and affordable health care will be any easier in the future than it is now. Chapter 2 of the Leger and Dunham-Taylor textbook covers stakeholders in the healthcare system. If you do not have this textbook, I have posted it online for you for this particular chapter. As you read the chapter, pay close attention to the section on payers. One of the things that makes the U.S. health system so unique is that we are a multi-payer system. Most developed nations are single-payer systems. Having multiple payers with different payment formulas presents a big challenge to providers. The practice exercise this week will help you to understand the concept of payer mix at a make-believe hospital. We'll look at real-life examples later in the trimester when you learn to read financial reports. Health insurance companies are one of the many payers, and there's many types of health insurance plans. Health insurance plans can be public, provided through governmental agencies, or they can be private. Some consumers buy individual health insurance plans, while other consumers have insurance through their employer. Each state has its own unique market for health insurance, with regulation at the state level. The language can be confusing. Read the section in Chapter 2 about health insurance carefully. I've also posted a great glossary of terms website on Canvas, and I encourage you to spend some time browsing the glossary of terms and look up any terms that are unfamiliar to you. This week probably seems like a massive amount of content, but most of it should already be familiar to you based on what you learned in your baccalaureate program and other courses you've taken in the graduate program. Remember, this week we're looking at the big picture of the whole U.S. healthcare system and how we got to the complicated and messy place we are today. You'll work through the lessons, the activities, and the assignments on Canvas. If you have questions, reach out to me or to one of your peers. Each assignment should be completed individually, but I encourage you to seek help when you need it. None of us work in a vacuum. We all work with teams of people, so I encourage you to learn from each other. Just make sure that you do learn the material. Next week, we're going to leave this macroeconomic view of the healthcare system, and we'll zoom in on the activities and the decisions of healthcare organizations. So we'll be looking at microeconomics next week. You'll apply what you've learned so far as you look into what most healthcare managers actually do in the workplace. Have a great week. I'll talk to you soon.